Hello everyone and welcome to week number 9. This week we are focusing on the urgent care. So this week we're only going to have one chapter to focus on, and it's going to be on chapter 43. Now this is actually a chapter that you all have read when you were in the fundamentals course, so it will be more of just a review on medical emergencies and medical emergency preparedness. So let's go ahead and dive on in. So, when we talk about urgent care, that's really more defined as patients who need to be seen by a doctor right now. But they do not have any life-threatening conditions, maybe like that of a heart attack or profuse bleeding, something like that. Something that they can get in and out of quickly that does not warrant them to go to an emergency room. Urgent care facilities are able to treat patients with conditions that need intervention as soon as possible, and they are typically open 7 days a week, and their hours of operation do extend into the nights and weekends to accommodate pretty much everyone. But this chapter will also focus on medical emergencies and your responsibility in those emergencies. As a medical assistant, you will need training on these areas to make sure that you're prepared. Anytime there's any sort of an emergency, the first person that you should notify immediately is your physician. You may also need to call other support in to help you, depending on the severity. Some of those could be our emergency medical responders, our EMTs, or paramedics. Also, when we start talking about medical emergencies, please remember this is when that Good Samaritan law does fall into play. Now, it probably isn't the first time you've heard me talk about it, as we talked about it last quarter in fundamentals, or you also had it when you had your CPR and first aid training. But the Good Samaritan laws were established to encourage healthcare providers and professionals to volunteer in emergencies without the fear of any financial liability. As a medical assistant, you have 3 primary legal responsibilities when it does come to an emergency. First is a duty to act within your scope of practice. Second is to ensure and document consistent emergency and constant emergency readiness in your office. And third is to do all that you can to prevent the emergency in the future. This will mean that you need to make an emergency preparedness plan. There are some guidelines for providing emergency care, and as a medical assistant, you must stay up to date on the emergency plan of your office or facility and community. You may also need to handle emergencies that come in 3 main situations. This could be on the phone, which is one of the most common ones that you will see, near the medical office, or actually in the medical office itself. Now, every doctor's office will have what we call an emergency crash cart. This will be available for all different situations, and it will contain all supplies that may be needed during an emergency. And it should always be instantly accessible and ready for anyone to use in the office. With a crash cart, or close to it, would be an emergency medical box or drug box. Some of the drugs that you might see in there are things like Benadryl, epinephrine, insulin. You might see lidocaine or nitroglycerin. The crash cart itself may have medical supplies such as things to intubate or a resuscitator, maybe an AED. It'll have oxygen supplies. And the person who really gets the ability to make the decision on what should be in the crash cart and in your medicine box would be your physician. They're the ones who are going to determine what you're going to need depending on situations. So let's kind of get into the fun stuff and discuss some of the medical emergencies that you might encounter. Now, hopefully you remember all of this or some of this from your training last quarter when you had CPR and first aid. But one of the first things that you might see is CPR, which is called cardiopulmonary resuscitation. This can either be one person or two-person responders. That will change depending on if it's an adult or a child, or even for infants. Remember that the compression rate is 30 compressions to 2 breaths for adults, and for infants it's 15 and 2. You may also see respiratory distress. This could be a reaction to a long-term disease such as COPD or asthma, but it could also be due to emergency situations such as an anaphylactic response to a medication. As a medical assistant, you need to be able to recognize the signs and symptoms, which are acute anxiety with gasping breaths, bradypnea, cyanosis, failure of the chest to rise and fall, any nasal flaring, noisy breathing, or tachypnea. You might be asked as a medical assistant to apply oxygen to the patient, which is something that will be discussed later this week in your lab classes. You may also deal with hyperventilation or anaphylactic shock. Hyperventilation is a quick, shallow breathing or rapid breathing that results in the decrease of carbon dioxide to the blood, and it lowers your blood pressure. In this scenario, patients will start to feel some chest tightness, palpitations, a rapid pulse, and anxiety. An anaphylactic shock is a severe allergic reaction to a medication that causes respiratory distress due to swelling in the upper airways. And this could be from medications, bug bites, latex gloves, perfumes, pretty much anything that the patient is highly allergic to can cause an anaphylactic response. Some other non-life-threatening emergencies could be chest pain, shock, diabetic emergencies, bleeding, and open wounds. If a patient is having chest pain, heart attacks are the leading cause of death in both men and women. As a medical assistant, you will need to know what those signs and symptoms are to be able to look out for that. If a patient is having a heart attack, that results in pain in the middle or left side of the chest, and it's described as a sharp, stabbing, crushing, or squeezing pain. The pain may radiate to the left arm, up to the back, or down to the neck. If a patient calls you at the medical office and says that they're complaining of chest pains and you think it could be a heart attack, you need to keep the caller on the line and ask a coworker to call 911. Write down the patient's name and their location and stay on the phone with them until EMS does arrive, unless they have someone that could take them to the hospital instead. If a patient is in shock, that's a collapse of the cardiovascular system, and it is caused by an insufficient cardiac output. Signs and symptoms of this include weakness, rapid heart rate, thirst, cool or clammy skin. They could be confused or unresponsive and may complain of nausea. If a patient's having some sort of diabetic emergency, that could be either high or low blood sugars. If they're having low blood sugar, that tends to be more of the concern. It can drop very rapidly and make the patient feel confused or weak. It could make them have that cool or clammy skin again. And the best thing to do is if a patient has low blood sugar, you want to get them something to drink and something to eat quickly. I have a student who has taught me that frosting is the best way to bring up blood sugars right away. So if they've got something like that with them, please make sure that you're helping them use that. Remember that bleeding can be both internal or external. External bleeding occurs when the skin is broken, and this type of bleeding can be easily controlled. You want to apply pressure around the injured part and maintain pressure on the site. If the blood seeps through the first bandage dressing, Do not remove it, just apply more on top. If the bleeding is internal, this occurs with tissue damage and the intact skin. This type is most likely hard to diagnose without being in any sort of medical facility where you could take imaging. Open wounds are seldom life-threatening unless they penetrate the head, chest, throat, or abdomen. If those occur, you need to contact EMS immediately. As a medical assistant, one thing that you can do is always try to control the bleeding if possible. Most of the time, if the injury is not life-threatening, we will irrigate it, debris it, suture it, and give them antibiotics. Some other things that you could encounter are burns, hyperthermia or hypothermia, seizures, fainting, and syncope. If the patient has a burn of any type, you want to make sure that the area of the tissue that has been destroyed is taken care of right away. The severity of the burn will depend on the amount and the depth of tissue injured. When you're treating burns, use cool water to soothe the area if there's no broken blisters. Burns should be dressed with a dry, sterile dressing, and pain should be managed with injectable pain medication as only ordered by a provider. Hyperthermia is when you're having a prolonged exposure to heat that is higher than 105 degrees. And hypothermia is just the opposite. It's when you're exposed to too much cold weather. That could be anything under 95 degrees Fahrenheit. Emergency preparedness is, again, making sure that those plans are set in place. This can be in the event of human-caused disaster or disaster caused by Mother Nature. Examples could be earthquakes, tornadoes, hurricanes, fires, floods, or any acts of terrorism. All right, so your homework this week is going to make sure that you read your chapter in full. Again, this is a chapter we have talked about before, so maybe just review it, touch up on it, re-quiz yourself on it to see if you remember much about the week or this chapter. For your discussion board this week, we will be focusing on your triaging skills and knowing who comes first. So your discussion post will give you a scenario, and you will need to decipher the scenario and make triage judgment calls. You will need to think about how you're going to prepare for the situation in the scenario, think about what your plan is, think about other resources or extra help you could use, and what kind of supplies that you will need to make sure that you have on hand. You will have to treat 10 patients, and you will need to explain how you would treat those 10 patients based off of the situation and the scenario you are given. Please make sure, as always, that your initial discussion post is completed no later than Tuesday, November 29th by midnight, and that at least one reply post to a classmate is created no later than Saturday, December 3rd by midnight. Lastly, you will have one quiz this week. Your quiz is going to be over Chapter 43 and dealing with medical emergencies. It will consist of 10 multiple choice questions, and you will have a 10-minute time limit. This is an online quiz, so it will be due Sunday, December 4th by midnight. All right, guys, that's all I have for you this week. If you have any questions or concerns, please let me know. I will be available via email and phone. I hope you have a wonderful week 9, and I hope that you all are very excited as the end of the quarter is now creeping near. Bye, guys.